Hello, my name is John Emmanuel, and I'm presenting to you my final project on community assessment of Gwinnett County, Georgia. And this course is GPH 732, presented on October 16th, 2019. I would start briefly with an introduction of Gwinnett County. Gwinnett County is located in the north central portion of Georgia. As of 2018, the population of Gwinnett County was estimated at about 927,781. That's almost a million people in Gwinnett County. And also, Gwinnett County is considered to be urban in settlement distribution, 98% urban. It's a major town, major city, and I would say that based on the gender demography, it's about 48.9% males and 51% or slightly above the male population. So we have more females than males. One thing about Gwinnett County is that it is racially and ethnically diverse, and that it's actually very and is depicted in this slide. So we see that about 53% of the population in Georgia, Gwinnett County, are white. We have about 20, following closely by the blacks, which are about 28% black, Asian population. We have a Korean Asians, we have Asian Indians, Vietnamese, and the Chinese sharing about 24% of the remaining population, and we have 2.9% non-Hispanic. And it's interesting to note that the median household income for Gwinnett County is slightly higher than the state. And we can see that coming in at $64,496 as opposed to the state um, median income of $52,977,000. Now, this is the windshield survey, which I drove around town and took some pictures. Um, and some of these pictures also I got from the internet as well, just to support this presentation. The picture above there is the Suwannee Town Park. Town Park. It's located in the city where I live. It's filled with a lot of hiking trails across the Suwannee Town Park. And also another famous town park in Gwinnett County is the Picnicville Town Park, which I've gone for many activities in the park, the Picnicville Park as well. Another thing that is common, another team area that is common in Gwinnett County is the Gwinnett Aquatic Center in Norcross, Georgia. And we have a lot of restaurant chains in Gwinnett County, Applebee's. One of my favorite is a Thai restaurant around town. We have a lot of southern food, and also a very famous one is Papado. Papado is a very it has a New Orleans type restaurant, and it's also common around other cities in the U.S. Just on based on the windshield survey, I also talked to there are a lot of sporting complex which promotes a healthy lifestyle such as early fitness. And there's a new one I think is everywhere now is the Orange Theory. Orange Theory is everywhere, and is also a fitness program that helps people get in shape. And hopefully, I get to join those fitness programs. Another thing that I noticed in the windshield survey around Gwinnett County is the fact that we have a lot of outpatient clinics, um, schools, high school, middle schools. The one popular one is the North Gwinnett High School because it's also one of the top 10 high schools in Georgia. Gwinnett Medical Clinic around town. We have major hospitals. We have Gwinnett Medical Center hospitals, and also it has two campuses, one in Lawrenceville, another in Duluth. These are part of the community assets as we discussed during the course of this project, the community assets and capabilities. So all these schools, colleges are part of those community assets. And that leads me to the methodology. The methodology here applied to this community assessment for Gwinnett County is the MAP model, which is an acronym for mobilizing for action through planning and partnerships. Another one of there's another model called proceed proceed model, but for this particular assessment, I opted to use the MAP model because it's more community focused, a strategic planning process designed to improve the quality of life of residents by mobilizing partnerships and taking strategic actions. Now, it's important to note that the MAP model approaches based on the process of maximizing available community as health resources, assets of the community to identify the needs of the Gwinnett County community. That's very important, and it's divided into six phases. We have development phase based on gathering stakeholders and partnership phase. We have visioning phase, which I feel is the most important phase because when there is no vision, there's no way you can the community can get what they actually need from the perspective of the stakeholders. We have assets assessment phase, we have the strategic issue phase, we have the goal setting phase, and finally the actions cycle phase, which is putting everything in perspective and getting um, the action aspect of it dealt with. I would say the next is the health profile. The health profile, this is the leading based on the leading cause of death or based on the indices in Gwinnett County, we have the leading cause of death as ischemic heart disease and vascular disease. We have cerebrovascular disease. We have Alzheimer's disease. We have COPD, which is acronym for chronic obstructive pulmonary disease. We have hypertension and hypertensive renal disease and the heart disease in itself. Now, it's important to note that Gwinnett County is among the fifth healthiest county in the state of Georgia. That's interesting. As part of the health status assessment, one of the things that stands out is the fact that infant mortality rate um, is about 7.8% deaths per thousand live births, which is higher than the state average of 7.3 deaths per 1,000 live birth. This prompted um, me to go in depth in terms of gathering the health priority for Gwinnett County. And that will bring me to the interview that I had with Dr. Mortola, who is an MD, MBA, that also works at Family Wellness MD, which is a pediatric um, um, outpatient clinic here in Gwinnett County. And out of part of my interview process was to identify the top cause of infant mortality in Gwinnett County, which she alluded to as SIDS, which is sudden infant death syndrome. And that will lead me to the information that I got that the data of infant mortality still does not achieve the health um, people 2020 target, which is to have about 6.0 infant deaths per thousand live births, while Gwinnett County is following at 7.8. That is a little bit high. So why is that the case? It is the number one disease that impacts the infant mortality rates. Um, or even we have other sleep related infant death broadly categorized as sudden unexpected infant death syndrome. And it is also important to note that there's an inverse association between gestational age, and the seed. So it's important to know that in premature babies and infant babies, they are more likely to be put on the bed based on the fact that they are little and they are small, and to share in just to have like a good hands-on easy access to them, and that actually is a major risk factor for seeds. Now, what are the major findings that I found out in the county, in Gwinnett County, based on the results of assessment and the face-to-face interview I had with Dr. Motola of the family wellness? She gave a, a perspective on pediatric health population, which I found out that infant mortality was high, and specifically for seeds. And she also mentioned that based on the census of patient that she takes care of, is the fact that Hispanic and African American population are the population that still needs a lot of work and improvement. Infant mortality rate in an African American population is about 12.5%. I'm sorry, 12.5 per thousand live births, which is about 60% greater than the overall value. And she mentioned very clearly that possibility exists for partnership and private nonprofit organizations, which will help vulnerable populations and diverse populations. Now, what are the recommendations? One of the things she recommended and I researched was adoption of a group called Safe to Sleep, which is for women and children of bearing age. It helps them in adopting proper best practices that will help prevent SIDS. Educational training cannot be overemphasized. Prenatal mothers, creating awareness for them and how to prevent SIDS in newborns and infants. Advocacy is a big one, and just trying to get national public views and policy reviews around seeds. It's very important that will influence infant mortality in Gwinnett County. And that brings me to the last slide, which is the references on this subject matter. It was my pleasure to be a part of this class, and I hope this has fulfilled the requirements of community assessment. Thank you very much for listening. Have a wonderful day. Bye.